Hi everyone, this is Dr. Gaile Robredo-Vitas, a board-certified dermatologist, and I'm so happy to have you here for the Skin Summit. Since we're celebrating Skin Awareness Month, I'm here to talk about the common misconceptions we know about acne. Why is it important to discuss this? It is important because if you're planning to reset your regimen, then you must know what to consider when dealing with acne. I know you've heard a lot about acne and how one can have acne-prone skin, but how many of these facts are actually true? Let's find out now with 10 misconceptions about acne. First, acne is just a cosmetic condition. Acne is a common skin condition that is due to several factors, which include genetics, hormones, follicular plugging, bacterial colonization, and inflammation. While it may seem like a superficial concern, acne, when left untreated, can result in permanent scarring and may affect one's quality of life, mentally, physically, and even socially. It is not merely a cosmetic or aesthetic problem because some types of acne can be indicative of other medical conditions like your polycystic ovarian syndrome. Furthermore, individuals with severe acne may experience low self-esteem, anxiety, and even depression that need to be addressed. Second, acne only occurs in teenagers. While it is true that about 80 to 85% of adolescents or teenagers experience some form of acne, it doesn't always disappear when you reach adulthood. In fact, acne lesions can form and even appear for the first time in adulthood. Studies indicate that between 40 to 55% of the US adult population have been diagnosed with acne. Third, acne is caused by dirt or grease that hasn't been washed off properly. Contrary to what some people may think, hygiene has nothing to do with acne. It is a complex condition that occurs in our pilosebaceous units or oil glands where sweat and hair come out. And it is unrelated to dirt. Comedones, or those tiny bumps on your face more commonly known as blackheads and whiteheads, form when our oil glands produce too much oil, causing dead skin cells to stick together, therefore clogging our pores. When bacteria on our skin, called Cutibacterium acnes, is added to the equation, inflammation then occurs, and then you develop your acne lesions. This belief that dirt causes acne often leads to overwashing and even overexfoliating with harsh soaps and abrasive scrubs or cleansing brushes, which contribute to the disruption of the skin's natural lipids, leading to dry and dehydrated skin that causes the skin to become sensitive and irritated. Number 4. Wearing makeup causes acne and breakouts. There's a type of acne caused by skincare products and cosmetics, including makeup, known as acne cosmetica. This is due to products and ingredients that clog your pores, but they typically resolve when you discontinue using these products. Putting on makeup is okay as long as you properly clean your face and you do not sleep with makeup on. It may also be helpful to choose products that are non-comedogenic, non-acnegenic, oil-free, and says won't clog your pores. Some makeup products like concealers are specifically formulated to help camouflage redness and pimples and contain ingredients like benzoyl peroxide, resorcinol, or salicylic acid that may help improve acne lesions. Others have ingredients that help absorb excess oil, prevent irritation, and have anti-inflammatory properties that reduce skin irritation and repair the skin barrier. When wearing makeup, make sure to apply them gently using your own brushes that are properly cleaned to ensure that bacteria, dead skin cells, and oil are not spread to the skin, which can lead to new breakouts. When removing them, do not scrub vigorously. Instead, use makeup removers like your balm emulsions or micellar cleansers, followed by a mild cleanser that is rinsed off with lukewarm water to minimize skin irritation. Number 5. Moisturizers cause acne. Moisturizers work by keeping your skin hydrated. Moisturization is definitely not a treatment for acne, but using moisturizers will not make your acne worse. Though it may seem that putting on moisturizers contribute to pore clogging and buildup, applying the right type of moisturizer, such as a lightweight, gel, or water-based variant, on a regular basis should be fine. Some studies even show that regular use of moisturizers can enhance efficacy, alleviate dryness, and improve skin comfort in people who use topical acne treatments like antibiotics, retinoids, and salicylic acid, or those taking oral isotretinoin. Moisturization may have a place in your acne prevention routine, just not as a direct treatment for breakouts. Number 6. Chocolates and greasy food cause acne. Everyone will agree that having a healthy, balanced diet is definitely beneficial, not only for our skin, but for our body as a whole. However, many put the blame on certain types of food for getting acne lesions. Chocolates, oily or greasy food do not cause acne. However, there is growing evidence that consuming food high in simple sugars, refined carbohydrates, and milk cause a spike in the hormone insulin, which is linked to increased incidences or exacerbation of existing acne, but larger scale studies are needed to prove the correlation. Number 7. Toothpaste can clear a pimple. I was actually guilty of using toothpaste to clear my acne lesions when I was a teenager. I don't exactly remember who taught me or where I got the idea, but for some reason at that time, I felt that the minty cooling sensation would make my lesions go away. Toothpastes contain baking soda, hydrogen peroxide, alcohol, and menthol that, yes, may dry pimples out, but these ingredients are not meant to be applied on the skin and can cause redness, itchiness, and irritation. Also, fluorides in some toothpastes can even worsen existing acne. Instead, I recommend that you go for a spot treatment containing salicylic acid or benzoyl peroxide to remedy and help dry out a pimple in those emergency situations. Number 8. Popping pimples helps get rid of acne faster. Popping or squeezing a pimple may make some heal faster or become less noticeable, but you risk making the pimple more inflamed, red, and painful. Also, you may push the bacteria and debris deeper into your skin, spreading them and worsening the infection, which can lead to scarring. It is best to let your pimple heal with continued use of your anti-acne medications, or if you have an important event coming up, you can come see us, your dermatologists, for a proper incision and drainage using sterile equipment or for an intralesional steroid injection. Number 9. Anti-acne medications work immediately. Just as acne lesions do not develop overnight, treating or controlling them will also take some time and a lot of patience. And it's not the same for everyone. I always tell my patients that acne medications may take up to 12 weeks to make a significant difference. Maintenance is also important. If you discontinue treatment when you start to see improvement, your acne can relapse as well. Number 10. There exists a miracle skincare product that will clear your skin immediately. What about those products you see online and in stores promising to cure acne? A lot of them come with testimonials from so many individuals sharing their experiences and how these products work for them. You might think, hey, they should be good enough for me too, right? The truth is, yes, some over-the-counter products and even changes in skincare routines might improve the skin of those who have mild acne, but for those with moderate to severe lesions, will need prescription medications. So now that we know the truth about these misconceptions, let us now talk about acne-prone skin and sensitive skin. How can one know if he or she has acne-prone skin or sensitive skin? Well, here are some tips so you can assess your skin properly. Acne-prone skin is often oily, easily breaks out, and one that often has comedones or blackheads and whiteheads. Whereas those with sensitive skin are individuals who experience unpleasant sensations like stinging, burning, pain, itchiness, and tingling sensations in response to stimuli that normally should not provoke such sensation, like applying skincare products. These unpleasant sensations are usually transient, with no visible signs such as roughness or irritation, meaning the skin can actually appear normal or sometimes slightly red. They cannot be explained by lesions attributable to any skin disease, but with an underlying mechanism that is neither immunologic or even allergic and can affect all body locations, especially the face. Now, how do you know if you have acne-prone or sensitive skin? Knowing your skin type is one helpful way of determining whether you have one or the other. Also, observing your skin and how it reacts to the products, ingredients, and the environment. You may also want to seek the guidance of an expert in skin, such as a board-certified dermatologist. Now, let's talk about maskne and how to avoid having one. Wearing masks for long hours causes maskne and is said to be due to the following. First is the type of mask used. Is it disposable, reusable, or washable? Is it made of cotton, cloth, or synthetic fibers? It is important to consider fabric and textile because skin interactions include factors like breathability, stickiness sensations, moisture saturation, and hygiene maintenance. Second, the microenvironment created on the skin and within the area covered by the mask. Expired air and perspiration creates a warm and humid microenvironment that may cause an increase in sebum secretion rate, said to increase by 10% for each 1 degree centigrade rise in temperature. Number 3, occlusion, friction, and local pressure on the skin can affect the pilosebaceous ducts or oil glands and disrupt or compromise the skin barrier function. And of course, number 4, individual factors such as skin type, habits and practices, and exposures. The most effective way to prevent the occurrence of maskne is to discontinue wearing masks. But of course, that is not an option that we can consider right now. To minimize the risk of developing maskne, I recommend the following. First, apply a protective moisturizer to preserve the skin barrier and protect against friction and pressure, ideally one that also provides sun protection. Second, avoid using makeup or irritating and drying ingredients on your face before putting on a mask. Third, minimize touching your face. Fourth, make sure that the mask you're using is clean. And when using washable or reusable masks, make sure that they have been washed with gentle cleansers or cleaned properly. Equally important is following a proper skincare routine. Properly clean your face before and after wearing masks using a gentle cleanser, one that cleans while preserving your skin's protective barrier made up of ceramides and natural lipids. Second, apply products and ingredients that are effective in treating acne. An example would be your topical retinoids, which are keratolytics and comedоlytics like your adapalene and tretinoin, or your topical antibiotics and antimicrobials for inflammatory lesions, mild papules, and pustules. Examples would be your clindamycin, erythromycin, and benzoyl peroxide. Also, do not hesitate to consult an expert such as a board-certified dermatologist. Now, I'll be sharing with you the best ingredients to have in your skincare routine so you can keep your acne-prone skin at bay. Patients frequently use over-the-counter products for their acne. Such treatments may be more accessible, cosmetically elegant, less expensive, and less irritating than prescription therapies. This is okay, but it is best to make an informed choice when buying products, especially for your face, rather than doing trial and error. First, let's talk about salicylic acid. It is an oil-loving anti-inflammatory ingredient that breaks down dead skin cells and goes deep inside your pores, clearing out dirt and debris and dissolving keratin plugs and comedones, or your blackheads and whiteheads. It is great for individuals with oily and acne-prone skin, and I recommend using products containing 1 to 2% of salicylic acid in any form that best suits your needs. Second is benzoyl peroxide, which works due to its comedоlytic and anti-inflammatory effects and its antimicrobial properties, and is able to reduce the levels of free fatty acids in the skin. In some individuals, benzoyl peroxide can have some undesirable side effects like redness, peeling, dryness, and pigmentary changes. Also, be careful in using benzoyl peroxide because it can cause bleaching of towels, bed sheets, pillowcases, and clothes. Third is a topical retinoid family made up of retinol, its natural derivatives like your retinoic acid, retinaldehyde and retinol esters, and several synthetic forms like adapalene and tazarotene. Retinoids are commonly found in anti-aging as well as anti-acne formulations. When used regularly and consistently, they help reduce fine lines and wrinkles, improve age spots and pigmentation, and help control oil production. Retinoids' effect on the skin happen via their interaction with specific nucleic acid receptors, and in vitro, they have been found to significantly reduce sebocyte proliferation, differentiation, and production of sebum. Fourth is niacinamide, also known as vitamin B3, which has been proven to regulate oil production. In a double-blind, placebo-controlled study by Dralos et al., it was revealed that topical 2% niacinamide significantly lowered sebum excretion rates after 2 and 4 weeks of use. In addition, it also supports the skin barrier by helping retain its natural moisture, calms inflammation and redness, and also improves pigmentation. There are some topical antibiotics that are being marketed as spot treatment, but we don't recommend monotherapy with antibiotics because it encourages bacterial resistance. It is equally important to have a sound skincare routine composed of proper cleansing with gentle cleansers that help control oil, exfoliation if desired, and sun protection. And that's it for this video. Once again, this is Dr. Gaile Robredo-Vitas. Thank you so much for joining me today, and I hope you learned more about acne and how to take care of your acne-prone skin so that you can be set for life. Bye! See you again soon!